Hi and welcome. I'm trying to learn medicine. Today, primary cold sores, and after we've done it, we're gonna do standing yoga. And if you participate in the little standing yoga, then it's better the hour risk. And we're talking about a disease and also about internal anatomy and also about a sexual transmittable disease. So we're talking a bit about that also. And this is no medical advice, we're just reading about it. Primary cold sores. So cold sores. The virus which causes cold sores, known medically as herpes simplex, is one of mankind's commonest infections. There are two types: HSV-1, which carries infections of the mouth, face and eyes, and HSV-2, which causes genital herpes. Over 50% of the adult population have antibodies to HSV-1 in the body, which means that at some time they have been affected. But only a few recall having had the rash. Okay, there's the virus, and that causes something called cold sores. And the medical name for that virus is either HSV-1 or HSV-2. HSV-1 has a rash at mouth, face, eyes or something, and HSV-2 causes genital herpes. And 50% of the whole population have HSV-1 in the blood, which means at some point in their life they have been affected, they have antibodies against it in their blood. That means 50% had at one point in their life HSV-1. Now that book is from Britain, so I don't know if it's now for the whole world, 50%. And the book is from the 80s. The virus lies dormant in the sensory nerve cells for many years, causing no trouble, but it can be activated at any time by stimuli such as fever, menstruation, extreme cold or sunburn. Okay, in the sensory nerve cells. Have a specific place, or just the sensory nerve cells? So somewhere in the sensory nerve cells, where it is sleeping, it's dormant there, and if a body is under stress by fever, menstruation, extreme cold or sunburn, then it can happen again. The virus can arise from its sleep. The infection is said to be primarily first attack or secondary recurring. Okay, some people have HSV-1 for the first time, then it's first attack, or for the second time, then it's recurring. Adults who escape infection during childhood are at risk. So if people did not have it as childhood, they can get it during adulthood. Primary cold sores. Children from 6 months to 5 years are most liable to this infection. Okay, very little children get it, most likely. Symptoms. Most commonly, the child is feverish and unwell for 3 or 4 days without any rash. The condition is treated as a cold, and only blood tests will reveal cold sores as the cause. Okay, the young child, so under 5 years, is for 3-4 days like a normal cold, like a normal cold sick, and only a blood test would reveal that the person has HSV-1. The less fortunate child will be ill with blisters, sores, and bleeding ulcers of the lips, the leaning of the cheeks, the gums, and the tongue. I'm not going to repeat it so much. That has a problem with the next thing. Also, I'm going to read it at once. Or where with all the chemical published as this. In a similar way, in girls, the vulva and vagina may be affected. In adults, especially nurses, dentists and doctors, the skin around the nail is affected. This is very painful and resembles a whitlow, except that no pus develops. I don't know what a whitlow is. Now, in adults, especially nurses, dentists and doctors, the skin around the nail is affected. Why? Because we get very infected, so it is there the strongest to see? Or is it that we're working so much with it? But the main thing is That's the most problematic thing if these people have it at their fingers. Is it when after these days of the illness span close, can't be transmitted, or is it the whole time? Or whatever. Let's read on. I think they have precautions. What the name of it is. Duration. The painful, distressing state lasts 7 to 10 days, and recovery with healing of the ulcers is complete within 3 weeks. Okay, around a week, and then around 3 weeks to heal the ulcers. Causes. A virus called herpes virus hominis. No, it's not herpes simplex, HSV1 or herpes, whatever. It's some type of virus. In adults, primary herpes maybe, no, we're talking about, I said it already, we're talking about sexually transmitted disease or something like that, I don't know, I haven't read it, but stuff like that. In adults, primary herpes may be contracted as a vermal disease and spread by sexual intercourse. See genital herpes. I don't know what contracted means. Whatever can be transmitted through sexual intercourse. Treatment in the home. Rinse the mouth frequently with diluted proprietary mouth washes. I don't know what diluted means. Or proprietary. No, whatever. This is not medical advice. Sip iced water. Use soothing cream to soften cracked lips. Now, and when to consult a doctor? If an infected child has atopic eczema, see the doctor at once because the condition can spread rapidly. No, I think we're gonna have eczema by EZ or by EC. I don't know what eczema is. But if someone has it, then there should be a rush to the doctor. If a child becomes generally more ill and drowsy, then you should consult the doctor. What the doctor might do: prescribe antiviral ointment. Is it an ointment? I don't know what ointments are. Prescribe antibiotic ointments as there is usually a secondary infection with bacteria. That is interesting. So two at the same time. Secondary infection with bacteria. Blood tests may be needed to confirm the diagnosis. In the case of the ill and drowsy child, check for other possible causes of the condition. Okay, if the child comes to the doctor and looks, if it is HSV1 or whatever, and then they can be given ointments. Whatever it is. Prevention. Adult sufferers should avoid contact with children. Infection of the fingers may be reduced by wearing protective gloves when in contact with possible infected areas and other people. So the fingers can be infected. And especially nurses, dentists and doctors have it. So have they got the infection not through... No, how's the infection? It sounds as if the infection is by contact and not by breathing. So these nurses, dentists and doctors have got it through their fingers. That means that either their gloves do not work or they haven't worn them properly. This is not an accusation, I'm searching for a cause. Adult sufferers should avoid contact with children. Outlook. Complete recovery is usual, although rare complications like meningitis and encephalitis to occur. Now, normally the recovery is good, but meningitis and encephalitis can occur, but the infection may be reactivated again and again as the current cold sores. So, it can get complications and come always back. Now, one thing interesting there, does it come back only if a person has something else, fever, menstruation, or what was the other thing here? Extreme cold or sunburn, or does it come just through age, or through if other autoimmune diseases attack the body? So if the person all over gets or less stable against infections. So basically the question is, does everyone who develops over the lifetime an autoimmune disease or just gets older and the immune system gets weaker, does it then come up again? Or has it be then actually like an extreme sunburn or the other thing, cold, menstruation or the other thing, fever, another infection or something. It's something different, because it is in the nerve cells. What was it here? It is in the sensory nerve cells. Maybe that is why it does, because I don't think it comes out, but it's why it does not come out if a person just gets an autoimmune disease or gets older. But only if they have a cold or sunburn, because that stresses the sensory nerve cells. I think this is an interesting point. Whatever. That was a medical part. If you are here for medicine, you can contract it to the next part of medicine. We will do now a short 5-minute yoga. If you stay participating in the short 5-minute yoga, let's let the arm risk. And the feet standing together, breathe in and lift the arms up. Breathe out the arms down. In and the arms up. Out and down. In and up. Out on the side. In and up. Out on the side. In and up. Inch space between the feet. Out on the side. In and up. Out on the side. In and up. Out on the side. In and up. And out and sit down. In and up. Out on the side. In and up. And out and down. In and up. And out, lean onto the knees. Breathe in. Out the head of the back. In into the middle. Out, long back. The belly. Again in. Out head. Back in. Out the belly. Again in. And out the front leg up at the top of the backward shoulder. Breathe in the arms up. Out arm to the side. In and up. Out over the sides, down into the chair. Breathe in halfway up. High up. And out and up. Breathe in, reach high. Out down to the side. In and up. And down the arms on the sides, down. Breathe in up. High up. And out and up. Breathe in, come up to tiptoes. And out and sink down. In and up. Down. In and up. And out the arms down, feet together, and your arm down. Breathe in, bend the right leg. And breathe out and stretch your left leg. Breathe in and change. Then out and stretch your right leg. In and change. Out and stretch your left leg. In and change. Out and stretch your left leg. In and change. And out and straight. Breathe in the right hand up to the sky. Breathe out, bend the left hand, look over the right shoulder to the right hand. In and down. In and down. Breathe in, lift the left hand up to the sky. Breathe out, bend the right knee, look over the left shoulder to the left hand. Breathe in, out and down. Make a hand for space between the feet. Shift the weight to the heels and breathe in and down. And out and up. In and down. And out and up. Last time in and down. And out and up. Take out of the elbows and gently rock from side to side. Hands in and down, feet together. Breathe in halfway up, straight back. Out and down. In halfway up, straight back. Out and down. And breathe in the up down swan. Hands up and down. Bring the palms together, elbows together. Breathe in and lift up. Down and down. And again, in and up. Out and down. Hands together, breathe in. And out, stretch your front, bring the head down. In back. And out and the front. In. Out and the front. Intertwine the fingers behind the back. Bring them over to one side. Tall up, shoulders back, breathe in. Out, hands, head over to one side. Chin onto the clavicle, turn to over to the side. The hands up, breathe in. And out, pull the arm in and shoulder down. And lift the gaze. Out, bring it over to the other side. Hands over to the other side, breathe in. Chin onto the clavicle, breathe out. Pull the arm in and shoulder down. Lift the gaze. Bring it back into the middle. And now the feet standing together and breathe in, lift the arms up. And breathe out, draw the shoulder blades together. In and up. Out, cross the arms, intertwine the fingers, breathe in, reach high. Breathe out, reach your front out of the back. In and up. Out, lean back, draw the shoulder blades together. In and up. And reach high, breathe in. Breathe out, reach your front. In and up. Out, lean back, draw the shoulder blades together. In and up. And out, lean with long arms back. In and up. Out and lean back, long arms. In and up. And out with arms down. In and up. Out the arms down. Now bring the arms up. Bring the hands to touch the lower, slowly down to heart center, breathe out. That was a short 5-minute yoga. I thank you very much and until next time.